first thing is I want this to be a space of growth, a space for us to all take away something. The second thing is genuinely understanding the impact and the power of our individual and our collective voices. And the last thing is, again, a call to action, right? Being able to acknowledge that we have to grow our education bases, realizing the power within our voices.
We had over 190 likes just for Dr. Wilkes coming on talking about healthcare, people, policy, and politics. So that being said, we're going to go ahead and get started. Dr. Wilkes is here. Wilkes is here with us. I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive. We are here to help you live your healthiest and wealthiest life. And that is spiritually, physically, financially, mentally, and emotionally. And the way that we do that is through our webinars, our podcasts, as well as our affirmation room. And yes, we do have a membership called Viva Life SPF Me. But it's not about me today. It is about Dr. Kylar Wiltz. He has a magnificent background. I got a chance to meet him through one of my Viva Life members, so I'm just going to go ahead and give a shout out to her for introducing us. This is our generation. I'm not even going to say next generation. This is our generation who is advocating for us, who is getting all the education that they need so that they can make your lives, our lives better in the long run. So Dr. Kylar, introduce yourself, give us your 30-second pitch, and then we'll get started with the top 3 things you want us to take away tonight.
Yeah, no, absolutely. Thank you so much, Dr. Kelly. To everyone here, my name is Dr. Kylar Wiltz. I'm originally from Breaux Bridge, Louisiana, the crawfish capital of the world for those that want an interesting fact. Went to undergrad Xavier University of Louisiana, where I was a biology pre-med, matriculated to Howard University, where I received my MD and my MBA, and then also got a couple of other degrees. My master's in healthcare administration from LSU Shreveport, my master's in public administration and public policy from Eastern Illinois University. So as you can see, I love education because I feel that for us to be able to give back, we have to make sure that we fill the voids within our own information basis so that we can become a part of the solution instead of kind of extending the problem due to our own gaps. And as far as, my 3 takeaways, for myself and for listeners, the first thing is I want this to be a space of growth, a space for us to all take away something, right? If anything in my background shows is that I genuinely value education, as it was instilled in me by my parents. My mom just hopped on as well. I can see at the top of the screen. Hi, mom.
Hey, Mama.
But then also coming to terms with and reflecting that, we don't know everything. I know that's kind of like one of those things in medicine where, everyone just kind of has to feel that, I have everything here. But the reality is there's always something that we need to learn, and there's always going to be something that we need to learn. So for this space, I don't only want it to be educational to listeners, but I want to take something away from you guys as well as I continue to learn. The second thing is genuinely understanding the impact and the power of our individual and our collective voices, right? For us to actually be able to not only understand what we have going on and grow our education basis, we also have to understand the power that is intrinsically in each and every one of us, the light that we have to provide to the world, the energy, the actions that we have to collectively come together and make a better society, a more perfect union, if you will, is dependent on us also acknowledging just the importance that we have when we just speak up. One of my mentors when I was kind of deciding my career path said that, if, with my hands in medicine, I could probably save 100 people. With my brain, I possibly could, save thousands. But with my voice in the right spaces, in the right rooms, that is how we collectively change and improve the lives of millions of people. And the last thing is, again, a call to action, right? Being able to acknowledge that we have to grow our education bases, realizing the power within our voices, and ultimately using those things to motivate us to push for that more perfect union. So we can create a world that's more impactful, more positive, and more purposeful for each and every one of us. So, we could have our families, we could all buy houses, we could experience, going on 1 or 2 vacations a year and have a meaningful existence within our society and within our country.
So as y'all can already see, he is dropping gold nuggets, diamonds. So we're going to make sure that we're able to pick all of these up so that you can understand why this is so important for each one of us. So you started out with education and curiosity. Now, you're from Louisiana, right?
Absolutely.
Small town, crawfish capital of the
Can you
world.
hear it? Can you hear the
I can
accent?
hear, and you know what? Being a fellow Xavierite, being there for 4 years and almost going back every single year, it is a love of my heart. Louisiana has a big
Mhm.
space in my heart. But that being said, what was it in your being raised? You said your mom's on the line.
Mhm.
So what happened while you were being raised that made you so curious about, healthcare and what you can do and how you can make a difference?
Yeah, no, absolutely. I, I always first and foremost give glory to God, very strong in my faith, but I also would be remiss if I didn't outline, my mom, my dad, my stepdad, and my stepmom, just having that foundation, within my household for myself and my siblings, that education is the one thing that can never be taken from you. Education is how we change the world, is how we change our views on the world around us and how we become impactful individuals. So just kind of having that foundation, a product of that is, I just have to continue to learn. If there is something that I do not know, I need to find the answer to it. And that took me on a very untraditional path, but it's a path that I wouldn't trade for anything in this world. Not only, within the educational space, but it's also allowed me to develop a certain level of empathy when it comes to the implications of policy, when it comes to how I communicate with a person who is, in the examination room versus a person at a voter registration drive versus, when we're in these rooms, whether it be on the Hill in DC or whether it be, at a policy forum, right? Education is one of those things that allows us to be, malleable with it, being able to adapt into every space that's necessary for us, again, to create that more equitable society and help as many people as possible. I don't particularly see education as something that should be, oh, if you want to do it or if you don't. I think it's a necessary good for our society, but then just also for us to kind of have that life and understand the world around us.
So, being that you are very educated and have had many of these experiences, what do you tell somebody who says, you know what, it doesn't matter? The truth, the facts don't matter. Why is that so important that you truly understand from all of your MBA, your MD, your HCA? Why is it that like we all have to move forth and continue
Mhm.
learning, even in the face of people telling
Mhm.
us what we have been educated about and the metrics and the outcomes? None of that really matters.
I will honestly say and this is my own personal opinion. I think it a lot of times comes back to one, just the information ultimately being so complex and not having enough people to disseminate it to the level that everyone can understand. The reality is everyone that walks into a ballot booth isn't a physician. Everyone hasn't gone to college, everyone hasn't graduated high school, right? But at the same time, all of our voices are important. So being able to really kind of address that discrepancy in education or an understanding of the system is just as important as the system itself. And this again kind of ties back to the idea that with learning and knowing so much, it does weigh heavy. There is some truth to the term ignorance is bliss, right? When you understand the levers within governance or within what's happening overseas or even in our own neighborhoods, it weighs heavy, which again ultimately falls on those that know to kind of not carry the burden themselves, but take what they know and find ways to communicate and further build coalitions. I'm more of the thinking that people don't just not care. It's more so that it is painful when you truly understand that the reason why we have a prison pipeline within our public schools, the reason why we have one of the worst maternal mortality rates is because of policy. It's because of human-made things that we can ultimately fix, but sadly have neglected.
Oh,
And
go ahead.
and then I mean that was in it, and I was just going to say that that acknowledgement is extremely painful. One of, again, I mentioned earlier, one of my really good friends, Corinne, she's on here. We talk about these things all the time, just about the footwork ultimately that it does take to make change. And that effort, that realization of what it is going to take, it's painful. It's sometimes it's overwhelming, but it is something that we must do to again accomplish that more equitable society. That is definitely possible. We just have to believe that it is.
And I love the fact that, you know what, you're coming through now when we need
Mhm.
this the most. And I'm just going to pause right there because everybody, I believe, on this line understands we need this right now more than ever. That we don't give up, that we use our education and our experiences because, like you said, everybody is not going to have the degrees. There, everybody is not going to have the same experiences academically, professionally. But let me tell you, one of the greatest experiences for me was always what I learned being boots on the ground, feet on the
Mhm.
street, being in the community, understanding the volunteer service and why I was doing it. You brought up something really important to
Mhm.
me as an OBGYN,
Mhm.
and that's the maternal morbidity and mortality. One of the things that
Mhm.
we, my team and I, are working on is bringing a solution. That solution being we need to be the gap between the person being at home and the healthcare system, monitoring the vital signs from their home and us being able to watch that and then communicating with their healthcare system to get them into the appointment, into the
Mhm.
urgent care, or into the physician. Now you're going back to Louisiana. We know that
Mhm.
Louisiana has one of the highest morbidity and mortality rates alongside Mississippi in our nation. I'm in California. We have one of the lowest. Understanding this, understanding, you're going into family medicine as a residency. How are you going to
Mhm.
use your experiences to help turn the tables on the morbidity mortality for Louisiana?
Yeah, absolutely. And I will say this is a soapbox moment for me, and I'm definitely a contrarian, compared to, I probably say the larger space of healthcare, but I firmly disagree with this idea that physicians are only meant to be physicians. I feel that as soon as you take that Hippocratic oath, you are now dedicating yourself not only to the physical well-being, but the total well-being of your patients in the society and environment around them. Again, this is a subject that I don't feel is negotiable, right? If you are going to take the mantle and the financial benefits of it, because again, at the end of the day, whether we want to say we could be paid more, it costs a lot. Physicians are highly compensated, regardless of how we look at it. But with that responsibility and with those perks, you also have to be able to acknowledge the duty that you have to continue to commit yourself to the greater good. Me going back to Louisiana, while I mentioned to you before, it's kind of bittersweet because I've kind of been embedded in DC for so long. I'm trusting God is sending me there to again be a part of that new wave to really point out the issues that we have within our system. Not only coming from the outside of it, but being boots on the ground on ground zero. When I first did this presentation, this was around the pandemic time. So the lockdowns were happening, and this was, again, the biggest catalyst as to why I ultimately went to Eastern Illinois. And as I'm kind of on my side screen looking at some of these statistics, right? The United States ranks 37 out of 191 in overall healthcare efficiency. Can we really sit here and say that we've gotten better in that regard? Absolutely not. We also rank number one in the world in healthcare expenditures. Can we say we've gotten better at that? Absolutely not. And we also, in the developed world, rank last in maternal mortality rate. Now, this is a cumulative maternal mortality rate, which means that this includes everyone, women of Caucasian European descent, black and brown women, Asian women, so on and so forth. But when you remove Caucasian women from that statistic, it drops even further, which means that we have outcomes for our black and brown women in this country that are worse than some countries that do not even have plumbing.
I need you.
That is a fair.
I need you to say that one more time. That
Yeah,
right
we,
there.
we yes, we have outcomes for our black and brown women that are worse than some nations that do not have plumbing. And what that tells me is that this is a failure of policy. It's a failure of policy. I come from a family, black mom, black stepmom, black sisters. My fiance is black, so it's that entire experience is not only for me to just point like, oh, I'm a black man, so I'd have to worry about this. No, every single person around me is impacted by the implications of these policies. And when we again begin to speak about them, I could sit here and just throw these numbers like, oh, like, our healthcare expenditures per capita is 10,000, but that doesn't really hit people home. Versus if I walk into a living room and say that there are 5 black women here, but if they go into labor right now, 2 out of the 5 have a chance of dying. Your grandmother and your mom would die if they go into this to deliver a baby. That is more impactful. That's more raw. That pulls on people's emotion, which, as we've seen over the past 10 plus years, emotions win elections, which
Mm.
ultimately is how we are then able to activate policy to get changes that are necessary to improve the world, to improve our society. It's objectively crazy that we go through all of this training and we push ourselves beyond exhaustion, and we get into a system that is at a number of turns fallible, right? We go in here to save lives, but then you get exhausted. And we could even look at this in a situation of the professions with the highest suicide rates, our physicians. So the people that are here to heal are so burnt out that their mental health is deteriorating. It's a policy failure.
And you make such a good point, because I did just get a message that one of my colleagues' children
Mhm.
committed suicide, and suicide is a huge issue. Mental health and wellness is a huge gap that we have here in the United States, not just maternal care, but also
Mhm.
mental health and wellness. So when we talk about being unfortunately, at the bottom of the barrel, when we think about morbidity and mortality in certain areas, understanding that cardiovascular disease is the number one killer across everybody. And you're like, okay, we can do something
Yeah.
about this. But then when you parse out who it's affecting the most and
Yeah.
understanding that data, it's like, okay, the solutions that we can bring forth with this are so important. So that being said, we have about 10 minutes left, 8 to 7 minutes, excuse me, 8 to 10 minutes left. I want people, if you have any questions, to go ahead and drop them in the chat. Raise your hand. We're going to continue on with this conversation because we have one more point, which is our call to action
Mhm.
points, and anything else that Dr. Wiltz wanted to say that we did not get to. But I want us to be very much involved in saying, you know what, how are we going to be the solution? How are we going to deliver these solutions? Understanding that, yes, we do get tired. Yes, there
Yeah.
is burnout. However, if we are still breathing, walking, and on this earth, we have something to contribute so that we can make a difference. So, Dr.
Amen to
Will,
that.
yes, tell us about the call to action that you have for us and how we can go about, making a change, making that positive impact, not only in our own personal homes, our community, our country, our world.
Yeah, absolutely. I think that when looking at the grand landscape of things, and the most American way to look at it is we have an idea or a commitment, an ideology that is centered around being the best, right? America is number one. America, we are the land of innovation, land of the free, the home of the brave. But the statistics aren't currently matching the ideology. And if we want the responsibility, if we want the accolades of ultimately being number one, we absolutely have to do the groundwork that is necessary for us to get there. And the reality is, at one point we were. So we know what it takes. But at the same time, we have to be committed to not resting on our laurels anymore. We have modern problems that cannot be addressed with years old, decades old, centuries old, since we're 250 years old now, solutions. We have to change, we have to adapt. And this all starts with each and every one of us, with whatever energy, whatever part of our bandwidth that we have, to get on the ground, to meet people where they are, to be able to educate and to sit and indulge in these conversations. The biggest thing that I've realized by doing community organizing is that after decades of people just feeling disenfranchised, whether it be black men, black women, white people, whatever it is, people across the spectrum of Americanism, right? You develop this intrinsic place of apathy where regardless of what happens, I don't feel like anyone will listen. And that is why my second point is the realization and the actualization of each and every one of us to see when we look in the mirror that light within our eyes to be able to be a part of making this a better world. We have to give people that encouragement and that responsibility to be a part of the solution and not to be continuously beat down by the problems. The call of action is about realizing that voice that we have and that you aren't alone in this struggle. That the movement that we all have is one of collectivism, for us to be able to come together, see all of the problems that we have, and be able to address these solutions with modern views and modern ideas.
And I think you
So
make a great point there talking about don't isolate yourself, because that is one of
yeah.
the things. Distraction and isolation will keep people from continuing to come together and collaborate and have that
Yeah.
collectivism. So let's see, we do have a question here. How do you advise us future policymakers, policy advocates to keep pushing forward when there is current proof that the system does not care? We have the education and knowledge, but the system is strategically designed to ignore certain demographics.
So my response to that, and thank you so much for that response, Ebony, for that question is, while I did say that we can't rest on our past, we can also still learn from it as we look to the future, right? You know, the largest example of this, right, is the civil rights movement, which was 60 years at this point, but we still have our ancestors that experienced that, right? The thing with systems, on one side, the changes can happen, but these changes are incremental. The I Have a Dream speech didn't start when Dr. King was on the steps of the Lincoln Memorial. It started when the NAACP was founded. It started when the Civil War ended. It started when the first Black people landed in Jamestown, Virginia. These things, unfortunately, take a lot of time, which it requires such an immense amount of commitment, an immense amount of brain power, willpower, and faith that at the end of the day, whatever piece that you can put in can change the world around you. It's
Yeah,
it's it's such a divine commitment, but it's one that is necessary, and that we have to realize that while we may never experience the fruits of this labor, we have to hope that what we are doing will benefit. In my case, I don't have any kids, but my nieces and my nephews, and down the line, my kids and my grandkids, and so on and so forth. You know, sacrifice sometimes, while it is hard, it is necessary if we do want to experience a world that is more equitable and that is helping and beneficial to as many people as possible.
I think you just, you said a great point there when we started out. We started out saying, first, we cannot give up. If you are
Yeah,
here, if you are breathing, then
yeah,
it is your responsibility to use those talents, skills, knowledge, education, and experience to keep on making a difference, like you have been saying all through this conversation. And I
mhm,
know it's really hard for people to look out. And I'll be honest with you, ignorance is bliss. There are
yeah,
certain things that I have stopped doing so that I can keep my mind definitely focused and positive, so that I can get up every morning and in my meditation and prayer and journaling, I can actually hear, okay, what is it that you have for me to be downloaded into me so that I can do this today? What do I need to share with my internal and external network? What is it? How do I need to move differently so that we can make a difference, not only in, my life and my family's life, but how do we move differently so we can make a difference for our community, our country? And I always include the globe. The reason why is, as a retired U.S. Navy veteran, I didn't just stay
mhm,
right here where I am right now. I've been all over. And you too have gone across, our nation to get educated, to get learned, to have understanding. And now you're going into a place where you can truly see, okay, how do these actions that we take
mhm,
affect our space right now and 5, 10, 20, 30 years down the line? So
mhm.
I love
And
that question, and thank you. Go ahead.
yeah, no, and I always, to the point that you made about traveling, I always encourage people to get out and see the world, right? Again, being from where I'm from in Louisiana, the country part, you know, a lot of people, not only in my area, but across the South, across this country, aren't exposed to different cultures, to different people, to different ways of life. So again, it narrows our ability to see, like, like, could this be different? Could we have a different outcome? So, I'd say the most impactful trip that I've ever taken is in my MBA program. I did it's kind of like an intern fellowship with the World Bank Group, me and a couple of my classmates, and we did a consulting project on scaling healthcare models in Eastern Africa, where they flew us out for us to present our project in Nairobi. And that honestly was the most impactful trip that I've ever had in my life. just showing the different outlook, being in a country that, I'm not Kenyan or from there, but to not feel like, I guess, a minority for once. Is the similar feeling of when we're at HBCUs. But what it does is it allows you to operate with a mindset of, okay, if I'm here in a world with people that look just like me, what could be done? How would I go about policy? And then ultimately taking this and transferring it, okay, now that I'm back in the United States, while it may not be as homogeneous, the pot of resources is larger, right? The possibilities because of that gives us more tools at our disposal to again create what we need to see within our communities. But I would have never been able to develop that mindset if I wasn't able to be pulled out of that bubble and experience something different. To be able to understand perspectives from people who've lived completely different lives from me on the other side of the world.
I think that, travel to me is everything. And I want
Mhm.
everybody put in the chat. You can put a long sentence or a short sentence. What is one thing that you're taking away from this conversation that you're going to do differently? What is one thing that you're taking away from this conversation that you are going to do differently to make an impact in your community across the country? And, Dr. Wiltz, I'm going to ask you that same situation. You are heading to another place.
Mhm.
And so, what is something that you're taking from your last 10 years or 8 years
Mhm.
being in DC and that you're going to take to that residency program that you're heading into so that you can, impart some knowledge, but also learn about the experience?
Yeah, I think the easiest way for me to put it is I have to go harder.
Mhm.
To just be as blunt as possible. I have to, it was a lot harder for me to do a lot of my organizing in Louisiana when I was back in DC, but now I have no excuses, right? I understand that I'm there to train and residency comes first, but then my greater mission is to be able to make my home state a lot better in whichever way possible. So, where I'm looking to, wink at my mom because we partner on a lot of community initiatives. So looking at to be able, how do we continue to scale our grassroots organizing? What does a lot of the voter registration events that I've been, a part of, what does that look like now that my feet are actually on the ground? And really just, again, kind of exceeding the spaces that I've just been having access to. While I was in DC, I was fortunate enough to do healthcare policy for the National Disability Rights Network. But now that I'm in Louisiana, how do I get into these spaces more on the state level? How do I work with more advocacy groups to kind of scale work and to reach more and more people? So I have a ton of things that I'm, kind of trying to plan out right now, but I'm definitely going a lot harder. As I mentioned, I'm going to start a Substack as well to kind of serve as me taking these complex issues and being able to communicate them to people so they can kind of have that interest. I remember when I first started speaking about politics with my grandparents, and now they watch CNN more than I do. So but again, ultimately it shows the importance of being able to cultivate those conversations. And once you pique that interest and get people to understand how important it is, it gains a legs of its own. People want to be informed. They just need to know that it's possible for them to be.
And trust the person that's informing them. And I think that
Yeah,
you were
yeah,
very, after
absolutely.
our conversations, not just here, but before,
Mhm.
understanding that, trust begins with understanding where somebody's from and their experiences that they've had. So I ask people to tell me what's something that they're going to change. The benefits of arming myself with more education to uplift communities, volunteerism, sharing my knowledge and women's health with my community. So that being
Amen.
said,
Love
Dr.
those.
Will, let us know how we get in touch with you and how we can support you in your journey as you head back to Louisiana to make a difference and a change.
Yeah, no, absolutely. So, I was able to steal the at on Instagram before anyone did. So on Instagram, I'm at Dr. Wiltz. My Substack is at Dr. Kylar Wiltz. I'll also share that with you once I drop my first article, which should be in the first week. So if you wouldn't mind, sharing to people as well, I'd really genuinely appreciate it. And on LinkedIn, Kylar Wiltz as well. I'm always open to having conversations. so I can learn, also so you can learn, but then also about just organizing again. We have our back to school drive that we're planning back in Louisiana, and we're again also looking to scale to see how we could not only, bring in more people in our area, but even potentially be able to expand our efforts into other areas in the South Louisiana space, but then also include North Louisiana once resources and exposure continue to expand. So I have a lot of big plans, but I also have an amazing group of people and family around me that love me, that believe in me, and that's just down to ride. So I'm extremely, extremely excited about what this next 3 years holds for me. Also for you, Dr. Kelly, as your platform continues to grow, but then just Louisiana. Right. When people say, we're ranked at the bottom of everything, my response to that is, well, it just seems that we have a lot of potential to get to number one.
That's
And
right.
and I think that approach is something that we need to embed within ourselves, not only as Louisianians, but as Americans, because we've tasted what it is to be the best and at the front of everything. And even though we've fallen, one thing that Americans do, and Black and brown people do, we pick ourselves up and we continue to fight and push for what we believe in. And I think we need to pull back on those ideals and continue to trudge forward, because there's a light at the end of the tunnel. No matter how dark it is right now, the when the sun sets, it's gonna rise the next day, and we have to have that mindset. When the work gets tired, when it gets draining, when it gets overwhelming.
Absolutely. So I think y'all have heard it here. Dr. Kylar Wiltz. I'm Dr. Kelly OMD, your board certified OBGYN and healthcare executive. And we are so appreciative of you here. And the song that comes to mind is Nothing Can Stop Us. We all are way up. So
Amen.
that
Yes,
being
yes,
said, have
yes.
a wonderful evening, everybody. Check us out on drkellyomd.com and at Dr. Kylar Wiltz on his Substack, as well as at Dr. Wiltz on his Instagram. Have a great evening,
Yes.
everybody, and thanks for being with us.
Thank you all. Thank you. Thank you.
All right, all right. Thank you, thank you, thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please, please, please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.